Good evening. My name is Jennifer. I'll be your moderator this evening. I'd like to welcome you to our webinar, Treatment Options for Overactive Bladder, presented by Dr. Aisha K. Taylor. I would like to introduce Dr. Taylor, who is a fellowship-trained physician in female pelvic medicine and reconstructive surgery. She specializes in female pelvic reconstructive surgery as well as women's urologic conditions, of course, including OAB, stress and urge urinary incontinence, voiding dysfunction, pelvic organ prolapse, vulvar conditions, urologic conditions in pregnancy, and chronic pelvic pain. Prior to joining Chesapeake Urology in March 2019, Dr. Taylor was an assistant professor in the Department of Urology at the UMPC Magee Women's Hospital in Pittsburgh, one of the nation's top hospitals specializing in women's health care. Dr. Taylor received her medical degree from Harvard Medical School and completed her residency in urologic surgery at Northwestern Memorial Hospital before completing her fellowship in female pelvic medicine and reconstructive surgery at Case Western Reserve University. She's a member of the American Urological Association, the Society of Women in Urology, and the Society of Urodynamics and Female Urology. Welcome, Dr. Taylor.
Thank you. I want to welcome everyone who has joined the webinar this evening for this very, very, very important topic where we're going to be talking about regaining control of your bowel and bladder function. Just to reiterate, I have a specialty in female pelvic medicine and reconstructive surgery, and that's just a complicated word for telling patients that I am a lead urologist. I care about all things related to women's pelvic health, their bladder, their kidneys, and my mission is to help women live their best lives. Part of what I do is managing bowel incontinence and bladder incontinence, and that is what we're going to cover today. Bowel and bladder symptoms can really have a negative impact on your day-to-day function. So if you can relate to some of these comments on the slide, like if you find that you're drinking less before you go on a trip, or if you find that when you're out and you're at a movie, when we were able to go to the movie theaters and you often miss the best part of the show because of a bowel or bladder accident, or if you find that you make a bathroom plan when you're leaving your house and even though you know where every single bathroom is, you still worry that you won't make it, this is the right talk for you. Know that if you do relate to those statements, you're not alone. You're actually in good company because there are lots and lots of women who have bowel and bladder issues. In fact, out of the 330 million people we have in the United States, 50 million women suffer from overactive bladder, and an additional 20 million suffer from fecal incontinence. We believe that that number is actually significantly underestimated because patients don't realize that treatment is available. They think that they are alone, and they are embarrassed to talk about it with providers. That is evidenced by the fact that only half of those affected by the above conditions that have the most severe of symptoms seek treatment. Most people just think this is how it has to be. So let's talk about an understanding of conditions that affect your bowel and bladder. So your symptoms, if you could relate to the earlier slide, may be related to the condition of overactive bladder, which is characterized by sudden urges to urinate and an inability to hold or control your urine. Oftentimes, women may have a condition called urinary retention, which is characterized by difficulty completely emptying your bladder. The third category is fecal incontinence, which is the involuntary loss of stool. So let's just review normal bladder function. So you have the brain, and the brain sends a signal down the spinal cord. The spinal cord connects to a nerve that comes off your tailbone, which goes to the bladder. So as your bladder fills, it sends a signal back up this nerve, entering through the pelvis, up the spinal cord, and to your brain, telling your brain it's time to empty your bladder. The brain then sends a signal down the spinal cord to this nerve that travels from that pelvic bone to your bladder, telling the bladder it's cool and empty. The bladder then squeezes, the urethra relaxes, the pelvic floor relaxes, which results in normal voiding. Your bladder will force the urine out, the urethra will make sure your bladder is empty. So what is overactive bladder? Overactive bladder is an abnormal process between the brain and the nerve that feeds the bladder. So an overactive bladder is the frequent and urgent need to empty the bladder, and it often can result in unintentional urine loss. Some symptoms associated with overactive bladder include urinating, usually 8 or more times in a day. You may have urinary urgency where you feel a sudden sensation that you have to pee and you can't get rid of that urge and it's difficult to control. Urge incontinence is when you have that urgency, but you have a subsequent incontinence or involuntary loss of urine. And finally, there's nocturia, which is when you get up 2 or more times to go to the bathroom at night. So what goes on in the overactive bladder? Well, I already told you the problem is the nerve that goes to the bladder. So that signal between the brain and your bladder is disrupted. The nerve traveling to the bladder sends repeated signals to the bladder, resulting in repeated bladder contractions, which will result in you feeling an urgent need to urinate. You're going to rush to the bathroom, and you may even leak or use urine before you make it. So let's start talking about normal bowel function. No surprise here, the same nerve that is involved in bladder function is the same exact nerve that goes to the bowel. So usually when the rectum fills, and this is the end part of the colon here, when it's distended with stool, that stool sends a signal to stretch receptors that are located in the wall of the colon. That sends a signal up the nerve that is in the pelvis, up the spinal cord to the brain, and that tells you, yeah, it's time to empty our bowels. If it's a socially appropriate time, your brain then sends a signal down your spinal cord to that nerve, the sacral nerve 3 in your pelvis, that leads to the colon and allows for the contraction and evacuation of the rectum for stool and the relaxation of the pelvic floor muscles so that you can evacuate the stool. So what is fecal incontinence? It is the situation that occurs when that nerve pathway is not functioning properly. The nerve is firing, sending that signal up to the brain sending the signal back down, which results in an uncontrolled loss of solid, liquid, or even mucus. Your symptoms, if you have fecal incontinence, can include stool urgency, which is the sudden urge to pass stool that's uncontrollable. It can be fecal incontinence when you get that sudden urge to pass a bowel movement, but you're unable to stop the urge and you have a stool accident. And finally, there's passive fecal incontinence, which is the leakage of stool when you're not even aware of it. You just look down in your undergarments and you may see streaks. So these are all symptoms of fecal incontinence. Please understand that if you have these conditions that I just highlighted, it's not normal. It is not a normal part of getting older. Do not accept that. And it does not have to do with, oh my gosh, I'm just a woman and we go through these things. And there's nothing that you actually did to cause that. If you're having these symptoms, you don't have to live this way. You totally deserve better. If you have these bowel and bladder symptoms, it can have a really big negative impact on your quality of life, leading you to avoid physical activities, reduce your social interactions, avoid travel plans. You may suffer from depression, guilt. You may self-isolate because of this. You may not have the best intimate situation with your partner. You're avoiding sexual contact because this is so destructive in your life. It may lead to absence from work and decreased productivity if you're going to the bathroom frequently. And it results in a substantial cost if you're buying incontinence products. They're very, very expensive and not often covered by insurance. But rest assured, there's good news. There are treatments to help you regain control of your bowel and bladder symptoms. So let's review some of the treatments that are available. So we have algorithms, and it all starts with identifying that you have those symptoms, knowing that there's nothing to be embarrassed about because you are in good company with a number of people in the country that are suffering from these conditions. Once you understand that there is treatment, you can consult with a physician. You can discuss your symptoms. We can start with a baseline diary, review what your day to night bladder symptoms are. You may undergo some testing, and then we can talk about some treatment options. The initial treatment being bladder training exercises, lifestyle changes, prescription medications, and when those fail, advanced therapies, which I'll discuss very shortly. There's a similar pathway when it comes to fecal incontinence, either the urgency or the actual accidents or soiling. First, know that you're not alone again. Second, there's nothing to be embarrassed about. Third, there's treatment. You can consult with your doctor. We'll get a baseline analysis of what your symptoms are and get a bowel habit diary. You may undergo tests such as colonoscopy and some assessments of the muscles surrounding the anus and rectum. We'll discuss treatment options, including initial treatment such as dietary changes. Some people find that they may be lactose intolerant. They may discover that they have celiac disease and can't tolerate gluten. In situations where there have been prior surgeries, strengthening the muscle around the rectum and anus and doing pelvic floor exercises may help your symptoms. There are also over-the-counter medications, the anti-diarrheal medications that may help. But when those don't work, you follow up with your physician who will offer you advanced therapies, including sacral neuromodulation. There is transanal irrigation. In severe cases, there is actually reconstruction of the anal sphincter and muscles surrounding the rectum and anus, and also a creation of a new sphincter. So delving into the initial treatment for overactive bladder, when we talk about behavioral modifications, we're talking about stuff that you can do. There are techniques such as when you feel the urge and it's intense, you can simply squeeze your pelvic floor, and that may trigger the bladder to stop squeezing. Those are known as Kegel exercises, and not everyone knows how to do that. So we do offer for patients who don't have a good sense of how to work their pelvic floor, consultation with a pelvic floor physical therapist who will help you to know which muscles those are that are important to engage, and to give you good feedback in terms of knowing when to use those muscles and know you're using them in the right way. Other strategies include bladder retraining, such as if you get the urge to go, tell your bladder, I'm waiting 5 minutes. You increase that interval each time until you're able to hold your bladder more. Other things you can do include lifestyle changes. So there are a number of things that can impact how your bladder is acting. If you're drinking a lot of fluids, your bladder is going to make a lot of urine. So simply cutting back on some of your fluids can help reduce your symptoms. Caffeine and alcohol are notorious agents that cause the bladder to be seriously irritated. The result is uncontrolled bladder contractions. You're going to the bathroom frequently through the day and through the night. So simply cutting back on those things may result in a substantial improvement in your symptoms. When your behavioral modifications, including bladder training exercises and lifestyle changes, have failed to improve your symptoms, that's when one of us will offer you a medication. Now, there are 2 different classes of medication. One known as the beta-adrenoceptor agonist, which promotes bladder relaxation, which allows you to hold more urine. And there's another class of medications known as antimuscarinics. They specifically block the bladder from squeezing. That results in the frequency, urgency, and sometimes a leakage that occurs. When you have tried two medications or more and they have failed to improve your symptoms substantially, or you have intolerable side effects, dry mouth, constipation, or an increase in your blood pressure, it's time to revisit a specialist who will offer you third-line overactive bladder therapies. So I'm going to review these therapies, and I just want to remind you that when it comes to the bowel and bladder, remember the nerve is the issue. So that nerve that's running from the pelvis to the bladder is overfiring and is causing the bowel and the bladder issues. So our treatments are aimed at targeting the nerve. The most indirect way to target the nerve is through a process called percutaneous tibial nerve stimulation. So the tibial nerve is a nerve found in the ankle, and it travels up the leg and finds itself in contact with that very tricky, bad performing nerve that's in the pelvis. It's an in-office treatment. Acupuncture-like needle is inserted in your ankle, and it sends an electrical stimulation up that nerve to the pelvic sacral nerve. And through 12 weekly sessions that are 30 minutes each, some patients may experience a substantial improvement in their symptoms. After a 12-week course of initial therapy, if you experience a substantial improvement that you're happy with, you simply have to come back once a month for maintenance therapy. Focusing on a target of the nerve at the level of the bladder is Botox. Now, we've been using Botox in the bladder for neurologic bladder conditions, such as multiple sclerosis, stroke, or some spinal congenital abnormalities since the 70s. Botox injections in those conditions back then resulted in a substantial improvement in frequency, urgency, and leakage associated with the overactive bladder related to nerve damage. In 2012, Botox was approved for use in people who had these symptoms without a neurologic cause. The medication is injected through a cystoscopy after your bladder is numbed for 20 to 30 minutes, and the medication is injected along the bladder wall. It takes 2 to 3 weeks for the medication to take an effect and relax the bladder. And if you have a positive outcome, you only have to have this repeated every 6 months. So it's a good therapy for some people, and they do well for a long period of time. There is a small risk of urinary retention, but that's only in less than 5% of patients. And some women have found that this therapy is very, very helpful in managing their bladder symptoms. Finally, we have sacral neuromodulation. Sacral neuromodulation is the only therapy we have that targets that problem child, that sacral nerve specifically. We've been using it for several years, and although there's been a period of stability in the last 10 years where we haven't had much changes in the therapy, we previously only had a device that was non-MRI compatible, that required you to get battery changes in the operating room every 3 to 5 years. But in the last 5 years, we've had a revolution with this therapy. Sacral neuromodulation directly modulates the activity of that pelvic nerve, helping to restore bladder and bowel control. The therapy is done in a trial fashion, and it's a simple procedure. And if and only if the trial is successful, do you have a permanent implant that's placed that can provide therapy for up to 15 years. So let's talk about the newest, latest, greatest sacral neuromodulation technology, and that's AXONICS. So what is AXONICS therapy? AXONICS therapy is that wonderful sacral neuromodulation therapy that is a guideline recommended therapy that restores normal control of the bladder and the bowel. It is indicated as a treatment option, not just for overactive bladder symptoms, but also for those with retention. So Patients who might not be able to get Botox because they already have some degree of incomplete bladder emptying are an excellent candidate for sacral neuromodulation and specifically axonics therapy. Finally, it is a guideline recommended therapy indicated in the treatment of fecal incontinence, also known as stool accidents. So how does the therapy work? Axonics therapy through a nerve wire that is in direct contact with that nerve in your pelvis that sends all the signals between your bladder, the spinal cord, and brain. It provides gentle stimulation to the nerve to restore control of the bowel and the bladder. The stimulation can restore the normal communication that's missing when the nerve is just doing its own thing, such that the brain regains control of the bowel and bladder, which can ultimately result in a substantial improvement in your symptoms. Axonics actually offers a miniaturized implant that is the size of an Andes candy. It safely delivers therapy with a very tiny battery that's rechargeable. It's placed through a minimally invasive outpatient procedure, and the battery is designed to last up to 15 years. And this is pretty accurate with the size of the quarter. It's small, it's light, it's cute. In addition, Axonics is currently the only sacral neuromodulation therapy available on the market that is full body MRI compatible. This will change in the future, but just know Axonics was first. The implant does not have to be removed if you, for some reason, need a body MRI to look at why you may be having new back pain, you might have new joint issues, and MRIs can safely be performed when certain conditions are met if you should choose this therapy and have this implant. Axonics therapy allows you to control and help modulate your symptoms. There may be some days that you need more control. Well, you'll just take this remote that's pocket size and very easy to use, and you can adjust the settings to your current symptoms. It's easy and it's a discreet way to monitor and adjust your therapy without anybody knowing. They'll probably think you have a Tesla with a green key like that. So in terms of Axonics and its ability to be an active working therapy for 15 years, this is because it's a rechargeable system. And the charging is not a cumbersome thing. You can enjoy the freedom of charging when it's convenient, that fits into your schedule. People can charge every 1 to 2 weeks, and the charging time is 60 minutes or less, depending on how frequently you charge it. This picture shows a picture of the recharging belt, and this sitting right over the device. Women can sit down in their chair, you can watch TV, you can read, you can just take it easy while you're charging your device. Almost all patients who had Axonics implanted found that charging was very easy 1 year after therapy. 96% of patients after 1 year of implantation reported that charging in the frequency at which you had to do it and the duration is acceptable. 95% of patients reported having to only charge 7 days or less frequently. And this is an example of a patient who had a successful Axonics implant. Charging is as easy as anything. I can sit there and watch a program or read a book, and I can carry my remote control on my keychain just in case I'd ever need to use it, but I've never had to use it. The Axonics therapy is a therapy that keeps working. As your body may change over time and you may need better control, the technology and the therapy changes with you. When polled, 89% of patients who underwent Axonics therapy a year prior reported at a year they were still experiencing clinically significant improvement in their symptoms of incontinence and overactive bladder, or even their stool incontinence or bowel issues. 1 year after their implant, over 90% of patients were still satisfied with their results. 92% of patients said they would undergo the therapy again with the same expected results. And an example of another happy person after this therapy. It is just so fantastic to live a normal life. The implant procedure was much easier than what I initially thought it would be. So are you ready for symptom relief? If so, it's time to schedule a consultation. You can come in and see me and we can discuss where you are in your treatment journey, whether you're just beginning with behavioral modifications or lifestyle modifications, or you've tried medications and they haven't gotten better. We will talk with you about this therapy and determine if this is the therapy that's right for you. If you should decide that AXONICS is the right therapy for you, you'll have a chance to trial the therapy through an easy test that'll let you experience firsthand if the therapy works for you. Out of all of the treatment options we have for overactive bladder, for urinary retention, for stool accidents, this is the only therapy you get to try it before you buy it. There's nothing like it in medicine. The worst you have is that you tried something. And I tell you, the majority of patients that try this therapy have an awesome result. I would say 9 out of 10 patients. So if you're interested in taking the next step towards symptom relief for your bowel, your bladder, your urinary retention symptoms, please schedule an appointment with me. Let me help you to begin to live your best life because you truly deserve it.
Thank you, Dr. Taylor. Okay, one of our questions is, does weight or weight loss affect OAB?
So I would say that the research out there doesn't suggest a significant relationship to weight and overactive bladder symptoms. Weight does have an impact on stress urinary incontinence, which is leakage with coughing, straining, laughing. There has been evidence to support weight reduction and reducing those symptoms, but there's been no correlation really between overactive bladder symptoms and weight.
How invasive is the AXONICS implant, and can you please describe the procedure?
So the procedure is, I think invasive is not the best question to ask because in my view, any procedure is invasive because we're doing something to your body. But on a scale of 1 to 10 with a level of complication, with 10 being the most complicated surgery that is done and 1 being the least complicated, I would say the AXONICS procedure is about a 3. It's a very simple outpatient procedure. It involves a trial. The first part of the trial is where we work to get a lead wire in perfect contact with that troublesome, meddlesome nerve I told you about. That is the source of all the problems with people who have bowel and bladder symptoms. Once we get that lead wire in a position where it's an optimal contact for you to get an optimal result, you have like an external device and you get a trial period with that. During that trial period, we will assess your symptoms, we'll make adjustments and changes to the settings of the system. And after the trial period, if you feel like you have personally experienced a substantial improvement in your symptoms, then and only then do we implant the battery, the full rechargeable system. So the second part of the post-trial period is either if you didn't have a great result, which is not common with this therapy at all, we would pull the wire out. But if you had a great result, we would just simply connect you to the battery, which is placed under your skin, that is rechargeable, MRI compatible, and good for 15 years.
Okay, the next question, she's asking, how have the results been for women over the age of 75 with this therapy?
So that is an excellent question. So I have used the older system that is on the market. I didn't see as great of results as I'm seeing with AXONICS. So I would say that among my patients who are 70 years of age and older, as long as they don't have any issues with dementia or memory issues, they do really, really well. I would say 9 out of 10 patients go from the trial to having the device fully implanted. So I would say good results for most patients, irrespective of age. And the system itself is just so simple to use that prior stuff we had available for sacral neuromodulation, older patients felt overwhelmed by all the things that they had to do. But with this therapy, they're just like, this is easy. It's remarkable.
A question she's asking if insurance covers the AXONICS therapy, including Medicare.
Yes, it does. So the important thing to know about insurance companies and Medicare, I had this slide about how bowel and bladder symptoms negatively impact your life. They have a substantial negative impact on your quality of life, and insurance companies, including Medicare, put at their prime importance your quality of life. So incontinence procedures are covered by Medicare. With that said, Medicare has the 80 to 20 rule where 80% is covered and 20% is covered. So as long as you have the Medigap or that secondary insurance, it'll be covered and you don't have to worry.
She says, I have to pee 4 to 6 times every night and then usually only once or twice during the day. Is this overactive bladder and what can she do?
So what you're describing is what we talked about earlier in the slide. It fits in the big umbrella of overactive bladder symptoms. Because remember, overactive bladder includes symptoms of daytime frequency, going to the bathroom 8 times or more during the day. It includes that sensation of urgency. When you get the urge, you have to go right then. It includes urge incontinence, where when you don't go right then, you have incontinence. And it also includes nocturia. Nocturia is, by definition, when a person gets up 2 or more times per night. So nocturia is those symptoms, nighttime symptoms are probably some of the toughest symptoms that we have to manage. And I would recommend if you're struggling with that, schedule an appointment with me. We can get a bladder diary going and I can take a look at the bladder diary and make sure we know exactly what's going on with your bladder so that we can work to treating it. There are treatment options that are out there for your symptoms. I just encourage you to come see me so we can start working on getting you living your best life.
Next question is, for someone that suffers from both bladder and bowel incontinence,
Yes.
if they have the AXONICS therapy done, is that like one surgery and one
It is. Yes, that's an excellent question. Remember, during the talk, the whole problem resulting in most situations of the bowel and bladder issues is an abnormal nerve pathway between the brain and the bladder, or the brain and the rectum. The common thread is that pelvic nerve, the sacral nerve 3. So that nerve, sacral nerve 3, goes to both the bladder and rectum. And so patients who have both bowel and bladder symptoms can experience a substantial improvement in both of those symptoms. It is clinically indicated for people who have stool accidents. As a matter of fact, if you have stool accidents and happen to have bladder symptoms too, you are a candidate for this therapy up front. You don't have to try medications because this is one of the only therapies we have for bowel incontinence. But if you have bladder symptoms and you failed medications, this therapy will treat your bladder symptoms. I've also it's not a labeled use, but I've seen patients with constipation that happen to go with their bladder symptoms have an improvement in their constipation. So you only need one procedure that is including that trial. So you get the trial. Whatever the results of the trial is, if it's positive, which is the majority of patients who undergo this therapy, you get the battery that's rechargeable, and we're working on both your bowel and bladder symptoms simultaneously.
This attendee is asking, is increased flatulence with leakage treated as fecal incontinence?
If we're talking about stool leakage, if we're talking about the uncontrolled seepage of mucus from the rectum. This therapy, again, is a treatment for those symptoms. This is not a treatment for flatulence, but if you have that urgent stool feeling where you have to have a bowel movement right when you get the urge, or you'll have an accident, or you're noticing that you're soiling your underwear and not even aware of it, this is the treatment, one of the treatments we can offer to you for that.
Okay, last question that I have is, can you please explain how the remote control, what the remote control does with this AXONICS treatment?
So it's really important for everyone to understand that your bowel and bladder symptoms don't stay the same. And you know this from your own experience. Your bladder does not behave the same way it did when you were 5, when you were 17, when you were 30, when you were 60. So as we age, our bladders progressively have a worsening of symptoms. You can have increased frequency, urgency, worsen leakage. The nice thing about this therapy is that as your symptoms change, we can make modifications to the nerve stimulation to improve and optimize your symptom control. And what I will say is that the remote is the key to doing that. So you with the remote may find on a given day or over a period of time, I'm going more frequently or I'm having more accidents. Well, you simply use the remote to increase the settings to give yourself more control. There may be days where you feel like I don't need so much control. You can go down on the settings. It also allows you to switch between 2 different programs, which are both designed to optimally control your symptoms. And the newest remote is what patients would use to take with them to a body MRI for the MRI technologist to confirm that it's safe for you to undergo the MRI. So that's essentially what the remote is used for. I do want to say, and if there are additional questions, that's great. We take your well-being and your quality of life so seriously at Chesapeake. And if you do find that this is the right therapy for you, we're with you from beginning to forever, because you doing well is us doing well. We want you to live your best life. So making this decision, you're not going to be on your own. You're going to have a whole group of people that are just focused on your care.
Okay, we have 2 more questions. One from Dory, who says, how much success have you seen with the PTNS therapy, and how does it compare to the AXONICS therapy?
I have seen success with PTNS therapy. However, I would say that it is not at all anywhere close to the sacral neuromodulation. There's just no comparison. I think part of the reason why is the percutaneous tibial nerve stimulation, the PTNS, is indirectly stimulating the nerve that's responsible, while the sacral neuromodulation is directly interacting with that nerve. I would say that in my experience, 6 to 7 out of 10 patients have a good result with the PTNS therapy, but 9 out of 10 patients have a good result with the AXONICS therapy. And these are people with non-neurologic bladder and bowel conditions. When we're talking about patients with multiple sclerosis or spinal cord injuries, that's a completely different bird. But and PTNS requires a significant time commitment. You have to be in the office every week for 12 weeks for 30 minutes. A lot of people don't have that luxury. That has to be done between the hours of our operation, which is 8 a.m. to 4 a.m. It may be a good choice for people who are retired and can afford that time commitment, but the difference in time commitment between the therapies is also substantial. That's a great question.
Okay, and the last question I have is, what are the current medications that might offer some help with OAB?
So there are a ton of medications. The newest medication on the market that came out, I think it was 2012, is that beta adrenergic agonist. It's known as Myrbetriq. You may have seen the commercial with the bladder dragging the women to, sorry, my background is shifting, the bladder through the bowling alley. That is designed to relax the bladder, can be associated with some changes in your blood pressure. The other category of medications are called antimuscarinics. Antimuscarinics work by stopping bladder contractions. Instead of relaxing the bladder, they just inhibit the contractions. There are a bunch of them. They typically work about the same. I would say there are 2 medications that work better than the others, but they can be associated with dry mouth and constipation. In long term, there have been some concerns about its impact on cognitive function and its association with dementia. But there's a list of medications that are available to you, and really we're limited by what your insurance can cover. All insurances don't cover every medication, so we give you the best medication choice that your insurance plan covers.
Okay, that's all of our questions. Dr. Taylor, do you have anything to say in wrap up?
No, I just want to reiterate that you don't have to live being wet or having stool accidents. You truly deserve better. I'm fully committed to making sure that women do get better. And I just implore you to just come take a visit with me. See how we can get you living your best life as soon as possible. Thank you for joining us this evening.